Hi, everybody. My name is Paul Garrard. I'm a student loan consultant, and I'm very pleased to be working with the American Dental Education Association, ADEA, to provide you with some information on how to finance your dental school education. We're delighted that you are participating in the 2015 Pre-Dental Virtual Fair, and we trust that this short presentation will help answer some of your questions about financing dental school. Now, there are four key messages we'd like you to remember from this short presentation. Dental education remains an affordable and worthwhile investment, and there are many ways to finance a dental education. We certainly will be talking about student loans as part of that, but that leads to the next bullet point or key message that smart budgeting now leads to responsible borrowing, and that certainly will help you in repayment later after you get out of dental school. And folks, you have lots of help along the way. We're going to be looking at some important resources for you toward the end of this presentation. Let's take a look at the first key message. Dental education remains an affordable and worthwhile investment. U.S. News and World Report ranked dentistry the #1 job in the nation in January 2015, and dental school graduates are currently in the top 5% of wage earners in the country. One of the unique things about dentistry is that while some dental school graduates will opt for a residency program, some go immediately into practice and can begin aggressive repayment, and in some cases get their debts paid down, their student loans paid down in less than 10 years. So a number of reasons why dental education remains an affordable and worthwhile investment. Now, in terms of financing options, grants and scholarships are always the first choice because these are funds that do not have to be repaid. We would encourage you to speak with the financial aid office at your dental school in terms of how to apply and about the availability of these funds and also application deadlines. They may be based on need or merit or even a combination of both. There are also service commitment scholarships through organizations like the military or armed forces. Now, certainly part of the financing will come with student loans, and federal loans such as Direct Stafford and Direct Grad Plus tend to be the most popular. There are some loan repayment and forgiveness programs that may be associated with federal loans. There are also private loans available, and if you are considering a private loan in addition to or in lieu of federal loans, we strongly encourage you to speak with the financial aid office because in general, federal loans tend to be preferable to private loans. If you are an international student, there may be some private loans available for you as well. Please see the financial aid office. They should be able to help. In addition, you may be eligible for research fellowships and traineeships, work study, and also education tax breaks. Once again, always talk to the financial aid office about your financing options. Now, in terms of student loan debt, this is a look at some of the numbers associated with the debt levels for indebted graduates in the class of 2014 at dental schools around the country. You see the numbers there, but the clear takeaway from this slide is that almost 23% of graduates of dental schools in the class of 2014 either had no debt whatsoever in terms of student loans or debt less than $100,000. So very important for you to know that there are ways to get through school with no debt or minimal debt if you borrow responsibly. Now, some good news in terms of student loan debt for graduating dental students. Dentists have a great track record for repayment. You're well known for paying your student loans on time if you are a dental school graduate. In addition, you can fund the entire cost of attendance. That's a figure you can get from your financial aid office, and that includes your tuition and fees, any kind of medical insurance, books and supplies, and a living allowance. You can fund the entire cost of attendance with federal loans, Federal Stafford and Federal Grad Plus. We're not encouraging or suggesting you will need the full cost of attendance, but you can do that with federal loans without having to take out a private loan. More than a few dental school graduates can enter the income stream faster than their other health sciences colleagues because either they're not going to do a residency program or they're doing a shorter residency program, and that often sets up aggressive repayment of student loans. The last thing we'll mention in terms of good news on student loan debt is that it's easier than ever to track student loans. You may graduate from dental school with multiple federal loans, but in all likelihood, they will be serviced by the same loan servicer. And so, regardless of which repayment plan you choose, you can make one payment against all of your student loans. So, lots of good news on the student loan debt front for dental school students and graduates. Now, there's some not so good news on the student loan front for dental students and graduates as well. As you may know, most of the loans that you borrow in dental school, for some of you, it will be all of the loans you borrow, are what we call unsubsidized. And that simply means that interest builds up or accrues during school and during any grace period you have. Stafford loans have a 6-month grace period. That interest that builds up at some point, usually at repayment, will capitalize, meaning it will be added back to the original principal amount that you borrowed, and that causes your loan balance to grow. In addition, interest rates change each year on new federal loans, and while that in and of itself is not necessarily bad, the rate on new loans can be as high as 9.5% for federal Stafford loans and as high as 10.5% for direct grad plus. So the rates change every year and the rates on the new loans can be high. Once the rate is set, it is fixed for the life of the loan. There are also some possible changes coming to the income-driven repayment plans and forgiveness programs that many health sciences students, including dental students, are interested in. We'd encourage you to work closely with the financial aid office at your dental school to keep abreast of those changes. As we mentioned earlier, there are lots of places to go to get help with questions you have about financing a dental education. Always get in touch with your school's financial aid office, especially to ask them about grants and scholarships and the availability of those funds, how you apply, and about deadlines. You don't want to miss out on any kind of money that could help reduce how much you borrow. Also at adia.org/go-dental, look for the section on money matters. Lots of information there specifically for you. And you'll see a reference to a great resource called the AAMC ADIA Dental Loan Organizer and Calculator that will help you estimate what your repayment will look like, either in residency or directly in practice, depending on what you think your career path will look like when you graduate from dental school. We also encourage you to look at healthcareers.org, at explorehealthcareers.org, a great site with multiple resources on financing a dental school education. So lots of places to go for help. Now, in terms of takeaways and action items, be sure to establish contact with the financial aid office at your dental school. We've mentioned that numerous times. And remember that smart budgeting now and in dental school will help lead to responsible borrowing, and that certainly is going to help you when you graduate from dental school and start paying back your student loans. Work closely with the aid office and keep your radar up regarding any kind of changes to the student loan programs to see if they'll impact you. And be sure to pay down any kind of outstanding consumer debts that you have, because those cannot be added to the cost of attendance. In other words, you can't get financial aid to cover those. And if you have any student loans from an undergrad or post-bac program, always stay in good standing on those loans. On behalf of the American Dental Education Association, thank you very much for your interest in this presentation and best wishes in your career pursuits as a future dentist.